Good afternoon, and welcome to the Virginia Interfaith Center for Public Policy's live weekly broadcast. I'm Roberta Oster, the Communications Director. Our program brings you news and analysis about economic, racial, social, and environmental justice issues here in Virginia. We bring the expertise and perspective of legislators, community members, policy experts, and faith leaders. We keep you informed, and we keep our elected officials accountable. In keeping with the mission of the Virginia Interfaith Center, we will share resources and offer opportunities for you to get directly involved in our work advancing social justice and helping our neighbors. And this broadcast is interactive. You will be able to ask questions live of our experts while we're on the air, right on this Facebook feed. So please, we really care about what you think, and we appreciate your participation, so ask your questions. And now to today's program. Our focus is on COVID-19 health and safety standards, and I am pleased to introduce our guests. First is Debbie Berkowitz, who is Director of the Worker Health and Safety Program at the National Employment Law Project. Welcome, Debbie. Thank you for being here. And our next guest is Travis Parsons, who is Associate Director, Occupational Safety and Health at the Laborers Health and Safety Fund of North America. And Travis is a member of the Virginia Safety and Health Codes Board. And our moderator today is my colleague and friend, Kim Bobo, who is Executive Director of the Virginia Interfaith Center. Kim?
Thank you, Roberta. All right, well, we have a great show lined up today because we really have two of the best experts on this issue. Travis, our expert from Virginia here, and Debbie, our national expert, although Travis is a bit of a national expert too, but we're really lucky. So the first thing I want to know is, Travis, you serve on this Virginia Safety and Health Codes Board. What is that?
So it's the board within the state of Virginia, within the DOLI program, the Department of Labor and Industry, for the state OSHA program. It's a 14-member board of both people from representing labor, people representing employers, and there's also some ex officios from the government on the board. It's a pretty equally balanced board. And basically, they have to approve any rules that are set forth in the state of Virginia when it comes to Virginia OSHA programs. So just like we're dealing with the COVID emergency pandemic here, we had to approve the ETS and hopefully now the permanent standard.
You used to work for OSHA, and I thought OSHA was a federal program. How come we have a program here in Virginia? Can you explain that to me?
Yeah, so the way it works is I think there's 22 states that have a state program, and there's something like a number of 26 states that have some other things where they protect public employees. But about 22 states, so it's about 50-50 between the United States, have a state-run program, and then the rest of them are a federally run program. And the rules, the way they exist, is they have to be at least as protective as federal OSHA. So state programs can go out on their own and be more protective or have some more specific requirements of their workforce.
Awesome. Okay. So, Debbie, you have been following Virginia in terms of creating this emergency temporary standard. Is that something that lots of states have done?
Actually, Virginia has led the way in having their OSHA agency establish the first emergency temporary standard. Other states have had their governors issue executive orders that, provide some of the same protections. But Virginia really is the first state to use their existing OSHA framework, because you have a state plan and a state OSHA, to issue the emergency temporary standard, and is really sort of, I think, leading the way. And so congratulations to everybody here, because it's really the best step forward to mitigating the spread of COVID-19 in the workplace and then back out into the community.
So Travis, you served on the board that helped create this temporary standard. Can you tell us what are the main components of this standard? What does it do? Your business, what do you have to do with this?
Well, it's a pretty comprehensive, well-done standard. I would call it a strong standard. We put a lot of energy and effort into development of the standard, but it's also a very agile standard. So basically, the first and foremost thing you have to do is assess your risk on your work site. And then based on, there's 4 different categories: lower risk, medium risk, high risk, and very high risk. Based on where your workforce falls in that risk category triangle, they call it, is what protocols are in place and what you have to do when it comes down to it. And so your typical protocols like social distancing, hygiene, hand washing, using what we call the hierarchy of controls to control your work site. There's a training component. There's infectious disease preparedness written plan. If you're medium or higher risk, you have to have that written plan. You have to have what I would call a safety officer or an administrator of that program on your work sites. There's requirements for flexible leave policies, staggered work schedules. Also one of the very important things that I really like being a worker advocate is the big picture is the what I call anti-worker retaliation. So if a worker wants to speak up about a safety and health issue, they always have that right. But it's written specifically in this standard to have that right to speak up about COVID issues on your job. That's really important for workers to be able to speak up on a job about health and safety issues, report it up the chain of command, and get worker protection on the jobs. So that's a really strong piece at the end of this standard.
So Debbie, I know you watched this whole process. What do you think are some of the most impressive or good things about this temporary standard?
Well, I think it's clear that the focus was to protect workers at work, whether they be in high risk like healthcare or what they call medium sort of high risk like meat packing and poultry and factories, and then also in sort of lower risk jobs. Because, as I said before, to mitigate COVID-19 among the whole public, we have to mitigate the spread at work. And I think it requires all employers to sort of take a look at their workplace to figure out what the risks are. It requires all employers to make sure that workers can be socially distant. The governor has already sort of and proactively told employers that they have to provide masks, because as we know, that is one of the single best ways to prevent other people from getting sick, especially if you are asymptomatic or pre-symptomatic. So it has basic requirements for all employers. And then like for hospitals and healthcare, that's really stepped up protections and medium risk too. And in addition, I think one of the things that's very important for workers and employers is that if there's a positive case at work, they need to tell other people in the workplace so workers can figure out how to protect themselves and sort of know what to do. But also they have to notify the Department of Health in the state of Virginia. And if there are more than a certain number of cases, I think it was 3, they have to even notify OSHA. So therefore, the government will be aware of where it's spreading, so they can do contact tracing and all the kinds of things that are so important for the government to do to mitigate the spread. And I agree with Travis that the anti-retaliation provisions, saying it very clearly that employers can't fire or discriminate or retaliate against a worker for saying, listen, I don't think it's so safe here. And I think we need to sort of make it safer.
That's great. So Travis, how long does this standard last? It's a temporary standard. So how long does it go for?
So we put it into place. I forget the exact date, but it was 6 months or when the issuance of a permanent standard, which is what they're working on right now and proposing pretty soon. I think we have comment period ending in about a week and a half. I think that is the 26th or something you have to put comments in. So basically the ETS went into effect. It's in effect 6 months or less if they come out with a permanent standard. So 6 months would be a good marker to go by. Or if the governor were to release the state of emergency, which I don't think is happening anytime soon for COVID, unfortunately.
Okay, so it's sometime in January it will end if we don't put in place a permanent standard. Is that correct?
Yes.
Yes. Okay. So why do we need a permanent standard? Do we really think COVID's going to go on forever? Lord, help us.
Well, maybe Debbie can jump in after a comment here, but yes, we need a permanent standard because just like previous viruses, we have this ETS, but we're just going to have the next virus that comes to our doorstep and is going to threaten workers. So for me, the word is absolutely. We need a permanent standard to protect workers from COVID, and then this can be used as a model across the country as a bar how to protect workers from infectious diseases of the future. We'll have to custom fit for those viruses and those diseases, but it'll be somewhere we can go in the future instead of having nothing to rely on. For example, guidelines from the CDC are great, but they're non-enforceable. You can't really enforce guidelines, and we need standards to protect workers.
Nice. Okay. So what's different in the proposed permanent standard than the temporary standard? Debbie or Travis, either one of you?
They're actually the same. So
they're exactly the same?
Yep.
Okay.
Yeah. So one thing I just wanted to say is that, OSHA has standards for some infectious diseases. They have it just for one actually now before the ETS, and that's for bloodborne infectious diseases like HIV/AIDS. And that standard sort of gave all this protection to dentists and healthcare workers and, to provide gloves so that you can't get stuck, by a needle. It required certain kinds of that needles be used. So when a nurse or nurse practitioner or healthcare person gives you a shot, that the needle they can't, prick themselves with it, and it goes into the sort of sheath of the actual shot. So these are the kinds of protections, and that was passed in like the early 90s and really stopped the spread of a bloodborne infectious disease in the workplace. And so now we need to do the same with the kind of infectious disease that COVID-19 is, which are respirable transmitted. And of course, COVID-19 is so far in our history, at least in the OSHA law history, is the most deadly and the most contagious. And so it's really important to get those protections in place so that we mitigate the spread, because I think it's going to be around for a while, even though we'll have a vaccine, and eventually, people, it will stop spreading, but it'll be a while, but it'll be there for the next time. And that way we'll have both a bloodborne standard for infectious diseases passed by blood and one for respirable spread infections. And I also want to say one more thing, Kim and Travis, now that I'm yakking, and that is, sometimes industry lawyers who want to fight having a standard say, CDC guidance has changed and everything is different. And actually, the basic CDC guidance has not changed from the beginning. There's been some political interference to water it down, to say, consider this, or if possible, but the basic guidance of the kinds of protections healthcare workers need, the kind of protections you need if it's spreading in your workplace, like meat or poultry, or in prisons and in warehouses, it's the same protections. And to, have this be a standard would be great. And I think, California has a standard to protect healthcare workers from respirable infectious diseases, and now is looking at expanding it like Virginia did to all workers. And so this is, I'm sure California and Virginia will be working in tandem to get these things passed.
That's great. And do either of you see things you want to make changes in that would improve the standard now that we've had just, at least 2 months to sort of work with it?
Honestly, I think it was well done from the beginning. A lot of the criticisms of any standard are one size fits all. Well, this standard is a program standard, and therefore it is not a one size fits all. It's very elegantly done to fit into those risk categories. I don't know if I would change one bit.
Awesome. Debbie?
I sort of agree with Travis. I think I would probably take a little harder look at, there was a clause that was like a compromise clause that was included that said if companies were following some kind of CDC guidance, then they didn't have to comply with the standard, whichever is stronger. And that can be confusing. We just want people complying with the standard right now. I think we want to make that clear.
Great. So what's the process going to be on this, Travis? Like, how are we going to get from this temporary standard to the permanent standard? And will people have a chance to give their 2 cents on this?
Absolutely. Yes. Being a member of the boards, I have a lot of experience with Virginia when they set standards. So we had the 4 meetings for the ETS, and there was opportunity for public comment there. There's opportunity now until I think it's the 26th, the date of comment for official comments online. And then after that, there's going to be meetings, whether they're virtual or in person, depending on the virus and the spread. There will be an opportunity for public comment at every one of those meetings, just like any other Safety and Health Codes Board meeting. So, yes, people can get through electronically online. They can be part of the meetings, and then also they can follow what's called the Virginia Town Hall, which announces all the public meetings and all the information about the standard. Virginia Dolly also has a very helpful website that has a lot of information about the ETS, and then we'll have information about the permanent standard.
So this tiny URL on the screen right now, this is where you can make comments. And these comments really matter because we need to say we want these comments, we want these standards, we need these standards. And so our listeners are really encouraged to go there and make comments. Travis, tell us about what kind of comments are really the most effective. When you read the comments, what kind of things were you looking for?
So I really work on both sides of the aisle on this. So I'm first and foremost a worker advocate. So I would love for workers to have input and love for worker advocates like myself to have input on what's most protective on the work site. But then on the other hand, I also like to hear from contractors or in construction industry, which is mostly what I represent on the board is construction contractors. We really need to know how to help contractors protect workers through these regulations and then help them comply with the standards once they're coming out. So maybe if, the time in 6-month period's been since the standard, the ETS has been in effect, let us know what's difficult about the standard, how we can help. Maybe we need to change some things, maybe not. But let us know what your struggles are. At the end of the day, we're all here to protect workers.
Awesome. And what if like it doesn't affect me directly, but I just care about conditions for Virginians? Like, Debbie, what kind of thing would you tell people to go ahead and comment on? And is it hard? Is it hard to submit these comments?
No, it's not very hard. Virginia makes it easy. You can do it all online, which is very helpful. It's not like you have to go out and print things and mail it in. I would suggest taking a look. It's easy to find the standard that you're looking at. And I'm sure a lot of us have people that are working outside the workplace, and to just talk to them and think about them and go through what the standard requires and see if there are any gaps that, maybe was missed as we sort of work through here. I mean, I think people in Virginia work in a lot of different industries. There's the poultry industry and the meat industry. And, we even heard from poultry companies that they felt that the standard was right on the mark. So, I know I actually worked with somebody who worked in an office setting, who filed a complaint with OSHA and found the standard to be incredibly helpful because they had an employer where COVID was spreading and it wasn't informing them. Everybody was working very close together. And, if you talk to people, if you have a lot of the industries are open, and so to take a look at what the standard does. It's not written in Greek or anything. And, it's a really good, I would say, OSHA standards could always be better, but it is a good place to really mitigate the spread of COVID-19. It's got a good marker there. Yeah.
So what happened to your friend?
Well, I have to find out. She actually had decided not to go back to work because she was so terrified, and the company said to her she could be on unpaid leave. So this was like 2.5 weeks ago. So I need to get back. But one of the things I found out about Virginia OSHA, unlike federal OSHA, is there was no way for her to file a complaint online to the agency. She had to go and find somebody who had a printer and print out the form and fill it in, and then she scanned it back. And you have to have that ability on, a printer or computer. So one thing I would say that we really want Virginia OSHA to do, not just with this standard, is to provide a link on their website. The technology already exists to file the complaint online. So if workers don't sign the complaint, then most likely Virginia OSHA will not do an inspection, and you can keep your name confidential. But just calling into a complaint usually doesn't result in an inspection. So that's one of the things we found out in actually filing this complaint was just the whole system to file it needed a little bit of tweaking, and it's easy peasy to do. So hopefully, the governor and the Department of Labor and Industries will get on that. But yeah, people should read the standard, and you provide the link, which is great. And they learn a lot also about COVID-19.
So we have a question from a viewer saying, what workers are most vulnerable to COVID right now?
So, in terms of risk, in terms of occupation, anybody dealing with patients that are sick with COVID-19 are the highest risk. And then we look at where there are hot spots, where it's spreading because companies didn't implement social distancing and other measures. And, at the beginning and even in the middle, that's meat and poultry and warehouses. But also if you're in a occupation or workplace where you're dealing with customers, you're also at risk. And what we do know also is a lot of our essential workers who were out there during the pandemic when so much, all the white collar jobs were home, like mine, were Black and brown workers. And they really made up disproportionately a lot of the frontline jobs. And we know that they also have a much more severe impact with COVID. And so you see that they have higher rates and numbers of deaths. So, we want to especially make sure that all workers are protected, and especially those workers who are at highest risk for sort of a more severe impact from COVID that are out there.
Yeah, one thing I would add to that is mortuary workers or anybody handling a body that might be infected are also at high risk. And then, like Debbie said, anybody working in medical professions, obviously a higher risk there in our hospitals, and then on down through the medium risk and the lower risk. All workers are at risk if you're working with coworkers or the public. The only way you're not at risk is if you're working by yourself, which isn't the case for most workers.
Well, this sounds like such a great standard. Will it just go through without opposition, or is there going to be some concern about this? This sounds like a great standard. So why shouldn't it just happen like that? Travis?
There's always going to be opposition. A lot of people on the industry side, just quite frankly, are anti-regulation of any kind. They don't like regulation. I think wrongfully, they think that it's telling you how to run a job, and they just think they know how to run a job. And for me, a OSHA standard is the best way to protect workers, bar none. And it actually levels the playing field for what I call good actors. So what I mean by that is good acting workers, employers, contractors, whatever you're going to call them, everybody working together to protect workers out there. So when you have a standard where you know the rules and regulations and what you need to follow, and especially a standards program like written like this, it's right up front. And then for the good actors, you know how to protect workers instead of worrying about guidelines and things changing on the hour or by the day. I can't imagine being a safety director at a construction contractor if I had to just follow CDC guidelines, because I'd have to keep my eyes on the internet because it changes on the hour. So I don't know how to do that based on the way the standard's written. You know how to comply. Workers know how to comply as well. You know the training requirements, and you know how to protect people.
But are there places where it's clear that companies before this standard really weren't doing all they should to protect people?
Yes, unfortunately that happens. You're never going to prevent all of fraud. Let me give you just a prime example. Working with contractors, I work with contractors all the time. There's on construction job sites, they're very fabricated. They're called multi-employer job sites. So you have different contractors. You have the prime contractors, subcontractors of the subcontractors. So there's a lot of different people walking around, a lot of people interacting with each other. They need to know the rules to follow. And a prime contractor I was working with was really having, in the state of Virginia, I won't mention the contractor's name, but they were having big trouble getting their subcontractors to follow the CDC guidelines because they were not rules. Just because they were guidelines, they had, and it's the prime contractor's job to run their job and protect workers. It's their obligation. So it was really hard on that prime contractor to get subcontractors to fall in line without a rule. So now they said they're excited about this rule because now they can use this rule to enforce health and safety protections on their job for COVID.
Can I add something, Kim?
Of course.
You know, I was in federal OSHA for 6 years, and it is really clear from the data that OSHA regulations don't kill jobs. They prevent jobs from killing workers. And it is a win-win. Employers comply with OSHA regulations, and not only are lives saved, but they don't lose workers. They save money, injuries and illnesses are prevented, and it also will mitigate the spread of COVID-19 into the community.
Wow.
Thank you,
We've only got a few minutes left. I just want to have both of you explain again to people sort of how this came about. How did Virginia become the leader in worker safety with this standard? And what can we do going forward to ensure that Virginia keeps a good permanent standard? So, Travis, you want to go first, and then Debbie?
Well, you know, we all know what's going on with COVID across the country, but specifically to Virginia, there's a lot of meat and poultry workers in Virginia that unfortunately were having some outbreaks and were being exposed. I think that's where the attention really got started and the momentum. And I really have to commend Governor Northam and the state of Virginia and Dolly for protecting all workers. Because I think in the beginning it was a push for meat and poultry workers. And then they were really forward thinking by protecting all workers under Dolly jurisdiction, which is most workers in Virginia. So I think it started in that industry, and then it went across the industry, and governor mandated a couple months ago through governor mandates that created the ETS, and then the ETS, part of the ETS process leads to a permanent standard.
I think Travis said it right. I think it started with real outbreaks in communities and worker advocates and community advocates being very upset and communicating to the governor. This was especially focused on the widespread in poultry plants and in meat plants. And then other people came on board and said, it's also spreading here. We're very worried. We need protections. We need standards. And you have to give a lot of credit to the governor who's a doctor, and he got this, and he knows that you can mitigate the spread, and said, let's write a standard. And what's amazing is with federal OSHA, the AFL-CIO and hundreds of groups have petitioned the Secretary of Labor, Eugene Scalia, to issue an emergency temporary standard to protect workers, and he has totally refused to do that. And look how easy it was in Virginia to do this, and look how much protection it brought all the workers. So kudos to Virginia.
Awesome. Well, I would like to see that URL put up again. There it is. So if people want to participate in the process, all you have to do is click on this link, write it down, click on it, and then it'll take you to a place to make comments. And all you have to say is, I really like our temporary standard, and I think we should have an identical permanent standard. please extend the temporary standard, make it a permanent standard. You can do it really easily. Now, if you're also not on the Virginia Interfaith Center's email list, you should join it soon. Go to virginiainterfaithcenter.org. We will be sending out regular updates about where to comment, what to say, and also where the various places you can testify, either online or in person, will be this fall. So we do believe as Virginia Interfaith Center that this temporary now standard and soon to be hopefully permanent standard is really an important step for protecting workers, protecting businesses, and honestly protecting all of us in this economy. So Debbie and Travis, I'm so grateful for you helping us understand these issues. Any last words you want to say before we close? Travis?
Oh, okay. Yeah, so I just really appreciate the way they approach this standard and its versatility. I really think they did a good job by following a typical risk assessment process. So basically, depending on your job task, even within the same industry, you might fall up and down to different risk categories. So I appreciate its agility and the ability to protect workers without such onerous and stringent regulations. Most of the time when you hear the word regulation, people kind of cringe and think, oh gosh, what do I got to do now? Well, the way this standard is written is it's very versatile, and a lot of the requirements are tried and true based on science. They just work. So I really hope this standard is successful. I hope we're successful in having a permanent standard, and I commend Virginia for leading the way for the rest of the country.
Excellent. Debbie?
And thank you, Kim, and the Interfaith Worker Center for all the work you did to communicate with people, to explain it to people in Virginia and get everybody to participate. And I totally agree. People, if they have a couple of minutes, just send in a note saying we really support this standard and we should, make it permanent. I totally agree.
Awesome. Well, thank you so much. Don't forget to write down that URL and put in your comments in support of the permanent standard for infectious disease. Thank you so much for being with us today.
Thank you.
Thank you.